Hello everyone. In this lesson, I would like to talk about the urinalysis. There are 3 questions that we should be able to answer after we go over this question. Question number 1. What are the 3 main components of a complete urinalysis? Question number 2. When to perform a complete urinalysis? And question number 3. What are the components of urinalysis and how does it help us in the diagnosis of kidney disease? Let's talk about number 1. What are the 3 main components of a complete urinalysis? Well, a complete urinalysis contains the 3 components that include the growth evaluation, a dipstick analysis, and a microscopic analysis. In the growth evaluation, we look for the color, the turbidity of the urine, and is there any abnormalities that we find in the urine. The urine dipstick analysis, we will be able to find the urine protein, the urine red blood cell, urine white blood cell, the urine nitrates, urine leukoesterase, and in microscopic analysis, we'll be able to find the cast, such as red blood cell cast, white blood cell cast, eosinophil cast, and other type of cast. When to perform a complete urinalysis? When a person has evidence of kidney disease, such as edema, or illnesses that associates with kidney disease, such as active systemic lupus erythematosus, secondary hypertension. Or when a person has evidence of kidney disease, like albuminuria, acute or chronic reduction in GFR, or when we suspect a person has kidney stones, or when we clarify the findings that we find in dipsticks in patients who has hypertension, diabetes mellitus. Question number 3 we should be able to answer is what are the components of the urinalysis and how does it help us in the diagnosis of kidney disease? Number 1, red blood cells that often associate with glomerulonephritis in cases like kidney stones, hematologic disorders, any case of infections, tumors, trauma, or medications such as cyclophosphamide. However, we may be able to find red blood cells that give us a false positive hematuria when we eat a vegetable called beets, or when we take medications such as rifampin, chloroquine, hemoglobin, and myoglobin. Another component of the urinalysis that we should look at is the nitrate. Gram-negative bacteria such as E. coli or other types of enterococci will produce nitrates. We should also look at ketones, and ketones are usually positive when the patient has diabetes ketoacidosis or when the patient is in starvation. Number 4, bacteria is another component. Bacteria is a little important if there is a small number of bacteria. Most often it is contamination. However, in the patients who are pregnant, the positive finding in a urine analysis with bacteria should be worked up. The patient who are pregnant are at risk for pyelonephritis in 30% of the time, and patients who are undergoing urinary surgery with a positive urine bacteria should have further workup as well. Number 5, we look at is the urine pH. Alkaline urine are more risk for forming stone, specifically when the patient is positive for ureus infection. Urinary pH is also helpful in differentiating the types of renotubular acidosis. For example, distal renotubular acidosis usually has high urine pH, whereas proximal renotubular acidosis has variable urinary pH, often with a lower urine pH. Number 6 we want to look at is the white blood cells. White blood cells in urine indicates any kind of infection and or interstitial nephritis. So detecting eosinophils with high cell stain or right stain is important. Another component we look at is specific gravity. Often when a patient is dehydrated, we have higher specific gravity in the urine. Protein. another component is leukoesterase or leukocyte esterase that is released by lysed neutrophils and macrophages. It is a marker for the presence of WBC or white blood cell, and it can be a false result when the urine is concentrated. Concentrated urine impedes cell lysis. And this is the end of our lesson for urinalysis. Let's review 3 components of complete urinalysis, when to perform urinalysis, and how should we interpret the urinalysis? What are the components of the urinalysis, and how does it help us to diagnose kidney disease? Now you can close your book and quiz yourself on these 3 questions. Thank you.